Hi everyone, and in this video we're just going to briefly discuss some of the common posterior landmarks that we use as a clinician when a patient's lying prone or face down on the table, just for a quick find on the back. So some people ask, how do we know where we're going? How do we know where we're placing our hands? And these are just some of the quick find tools that practitioners can use to quickly landmark the upper back, the middle back, and the lower back in particular. So the next video we're just going to see are three common areas. We have T3, T7, L4, L5 and S2. There are a couple of very common landmarks and there's some important structures around those areas. So when we're landmarking the patient in a prone position, and obviously this isn't a real patient, we have Jack, our skeletal model here. So when we place our hands across the upper back, one of the couple of quick landmarks that we can find are T3 and T7. So generally speaking, our T3 is normally at the superior border of the scapula. So when we place our hands when the shoulders are resting neutral, T3 is roughly at the third rib. So we're looking T3 level is approximately here. And then if we come straight down to the inferior angle and the border of that, we should be roughly at the T7 area crossing the mid-thoracics. So they're two quick find areas. So if we look at the C7 T1 junction, our C7 has an elongated transverse process, or not transverse process, spinous process. So it differentiates from some of the others in the cervical spine, has the longest spinous process, not transverse process. So that can be easily landmarked as well in relation to C7 and T1, where the first rib originates off. Now, if we're looking at the collarbone, which is here, we can see on the collarbone level, our first rib is actually, in relation to the collarbone, is actually sitting quite high. Commonly, people think where the second rib is actually below the collarbone level, which is what people think is our first rib. But in fact, our first rib is a lot higher, and it's attached to T1, which on the back, or the posterior of the patient, is a lot higher than the collarbones at the front. Now, if we come down, if we come to the iliac crest, which is another landmark that we can find. So with our patient, we basically place our hands around the iliac crest. And if we come directly across with our hands, we should be in the interspinous groove between L4 and L5. That's our interspinous groove. And then if we place our hands, so that's an easy landmark for L5, L4, L3, L2, L1, working up respectively. And then T12, which is here, is our 12th rib, directly off our T12. And then we have L1, 2, 3, 4, 5, if we count them down. And if we come across our iliac crest again, we should have the interspinous groove between L4 and L5. And then if we track down at a 45-degree angle from the iliac crest, we should roughly be able to circumduct our thumbs and find the PSIS, or the posterior superior iliac spine, PSIS. And from here, if we move directly across, we should be roughly at our S2 level. S1 here, S2 here. So again, across the iliac crest, we have our L4, L5. 45-degree angle, we have our PSIS, posterior superior iliac spine. And this should be, if it's neutral, we should be roughly at our S2 level. And there's some important landmarks. As we palpate down, the next bony landmark we should feel in the posterior, or the inferior aspect of the glute, is here, which is our ischial or ischial tuberosities, or our sits bones. Now, if from our iliac crest we track around to the front, the anterior, for the anterior superior iliac spine, translate inferiorly and laterally, we should be able to circumduct our hands and find the greater trochanter of the femur. If we come inferior and medially, we should find the lesser trochanter of the femur. So again, guys, that's a quick find on the posterior of the body, running from roughly T1, C7, T1, right through to the upper aspect of the femur for quick finding anatomy. Hi guys, well there you have it. It's just a quick little video demonstrating some of the landmarks in the posterior chain of the body from C7T1, working our way down to the upper aspect of the femurs, and just a quick find on anatomy. So it's just how some practitioners work their way around the human body when they have a patient lying face down, and it's how they would work down through for a quick find on the anatomy. Thanks again, guys. If you find the video helpful at all, hit us a like and subscribe, and thanks for watching. We'll see you again. Thanks a million, guys. Bye bye.